Good morning. I am Dr. Muhammad Ataullah, Senior Consultant Physician working at Care Malakpet Hospital. Today I will discuss some of the important issues which matter all of us today. And the first among them which I am going to discuss will be the common liver problems which we see in our day-to-day practice. So the most common liver problems which we see in our practice are because of viral hepatitis. Viral hepatitis is of two types. One is because of water contamination, or what we call it as foodborne or waterborne diseases, which is usually in the form of hepatitis A and hepatitis E. These are usually self-limiting, but occasionally they may cause some serious problems like hepatic encephalopathy. But apart from that, these are very self-limiting diseases, and you don't need to do anything to these diseases. Only thing is you need to follow up these patients with liver function tests and give them counseling regarding some dietary restrictions which may be necessary, or usually even dietary restrictions are also not necessary. The other common problems which we see because of viral hepatitis are because of hepatitis B and hepatitis C. These are again bloodborne transmission occurs here. So bloodborne means, suppose if somebody takes a injection from an uncontaminated syringe, or somebody shares his razor, or somebody shares some of the tattoos which other people have used tattooing equipment, then these people are likely to have hepatitis B and hepatitis C. Now universally all of us are screening blood which is given for patients who require blood for hepatitis B as well as hepatitis C. So day by day these hepatitis B and hepatitis C infections are also decreasing dramatically, and we are not seeing these hepatitis B and hepatitis C as we used to see some time back. The problem with these hepatitis B and hepatitis C chronic infections is that these infections over a period of time can lead to cirrhosis of liver, which is a damage to the liver where it cannot be brought back to normalcy. The liver cannot be brought back to normalcy once the patient has a chronic hepatitis B or hepatitis C. And drug treatment is also very costly for these hepatitis B and hepatitis C. And sometimes these infections ultimately can lead to hepatocellular carcinoma. So what we have to do is, first of all, whenever somebody has jaundice, we have to find out whether it is A, B, C or D or even E. And you have to treat them accordingly. But as I told you, because most of the laboratories are testing blood for hepatitis B and hepatitis C, these are not commonly seen these days. The most common entity which we are seeing these days is non-alcoholic fatty liver disease, or steatohepatitis of the liver. So this is becoming a very important problem, particularly in people who are obese or in people who are having type 2 diabetes mellitus. And these are also extremely important, and if you don't detect them and treat them properly, these people who have non-alcoholic steatohepatitis or non-alcoholic fatty liver disease may also lead to cancer or even cirrhosis of liver or even death. So this is becoming a very important problem these days. We generally, what we do is we ask the patient to undergo an ultrasound abdomen. The ultrasound abdomen reveals a fatty liver, and later on we do a fibroelastography, and sometimes we also do an MRI of the abdomen to know the fat liver content, and very rarely a liver biopsy is also done. But keep in mind that fatty liver disease or non-alcoholic steatohepatitis or non-alcoholic fatty liver disease is extremely common.